morning, everyone. My name is Jessi Crowley, and I'm a staff pharmacist at an Albertsons-owned Pavilions Pharmacy in Los Angeles, California. I'm here today in Portland ahead of the Federal Trade Commission preliminary injunction hearing against the proposed Kroger-Albertson mega merger. As a worker, I stand here today united with my fellow workers across states as we join the FTC and the 9 attorneys general, including California's Attorney General Rob Bonta, in efforts to block this merger. I'm representing thousands of my fellow UFCW Local 770 grocery and pharmacy workers in Southern California, whose lives will be negatively impacted should this merger be allowed to proceed. As our national Stop the Merger coalition of UFCW union locals has done for nearly 2 years, I'm here to discuss the possible harmful consequences of this merger on workers, consumers, patients, and our communities. I want to focus on the proposed Kroger-Albertsons mega merger and their store divestiture plan's potentially devastating impact on access to medications and pharmacy services. If the Kroger-Albertsons merger were to move forward, it will further reduce competition, limiting options to where patients can get affordable pharmacy services. As a pharmacist, I fear the consolidation of Kroger-Albertsons into one company will have the unintended consequence of reducing patient access to medication. Pharmacy is a complicated business, so complicated that even pharmacies with decades of experience are struggling to keep their doors open across our country. CNS wholesale grocers have extremely limited experience in pharmacy, making it highly unlikely that the divestiture plan will succeed. I've witnessed firsthand the challenges patients face when access to prescriptions is limited. If the merger is allowed to move forward, choices will narrow, disproportionately affecting low-income communities of color. History shows us that we can't trust merger promises, and the wholesale-retail transformation is risky. Competition is essential for maintaining medication access, especially during times like these when we're seeing some of the highest drug shortages of all time. Let's be clear, the mega merger will negatively impact retail workers, small suppliers, independent chains, and communities already facing challenges with food and medication access. As a union worker in California, in one of the only areas in the country where pharmacists are unionized, I'm also concerned that the merger will weaken our bargaining power for better working conditions, wages, and benefits. As a dedicated pharmacist who has devoted her life to caring for patients, I strongly oppose the Kroger-Albertsons merger. I'm hopeful this proposed mega merger will be blocked by the U.S. District Court. We know this legal process will take several weeks. In the meantime, I urge anyone who buys food and medicine to join me and my fellow workers in continued opposition of the proposed mega merger to protect our jobs, our stores, pharmacy access, and prevent further harm to our communities. Thank you.